Have you ever gone 4 or 5 days without a bowel movement and then ended up in the emergency room in pain, bloated, desperate for relief? If you're over 70, chances are you're not alone. Constipation is more than just an inconvenience. For many older adults, it can turn into a painful, even dangerous medical event. One viewer, an 85-year-old woman, shared a story that still gives me chills. After a traumatic car accident years ago, she developed an impacted bowel. The pain, she said, was the most supreme pain she'd ever felt. And that's saying a lot for someone with major fractures and head injuries. Now, decades later, she still watches her diet, her routines, and her bathroom habits with laser focus. Why? Because she never wants to go through that again. Constipation is often joked about or brushed off as a minor nuisance. But for older adults, it's a quality of life issue and a potential medical emergency. What makes it worse is that many people simply don't talk about it. It's personal, it's awkward, and many assume it's just part of getting older. But here's the truth, it doesn't have to be. In this video, we're going to take a serious look at a condition that affects millions of older Americans. We'll uncover why constipation becomes more common with age, how it can signal deeper health problems, and most importantly, how to take control of it before it controls you. Constipation might start off as a simple discomfort, a skipped day here, a bit of straining there. But as we age, those small signals can build into something much more serious. Why? Because the aging body changes in ways that make constipation more likely, more severe, and more dangerous. First, there's the impact on quality of life. When you're constantly bloated, uncomfortable, or dreading the bathroom, everyday life becomes harder. You might lose your appetite. You might stop enjoying meals. Over time, it's easy to become irritable, anxious, or even depressed. But it's not just about how you feel. Constipation can trigger real medical problems, especially for those with memory loss or cognitive decline. People with conditions like Alzheimer's may not be able to say, "I'm constipated." Instead, they may become restless or agitated. Caregivers may not realize that what looks like behavioral issues is actually physical discomfort. Worse still, straining regularly increases the risk of hemorrhoids, rectal pain, or even fecal incontinence. And yes, constipation can lead to those embarrassing accidents many fear. It's not just loose stool. It's what happens when a hard mass blocks the colon and softer material leaks around it. In hospitals especially, untreated constipation can contribute to delirium, a sudden change in mental state that makes recovery harder. One study found that among nursing home residents, nearly 60% had normal bowel frequency with laxatives, but 97% still had symptoms like straining, pain, or incomplete evacuation. And then there's the worst-case scenario, fecal impaction, a hardened ball of stool that causes severe abdominal pain and may require manual disimpaction, a procedure no one wants to go through. That's why in geriatrics, we take constipation seriously. Because when you're older, it's not just about comfort, it's about protecting your dignity, your health, and your independence. Let's clear something up first. Constipation isn't just about not going every day. It's more nuanced and surprisingly personal. What's normal for one person may not be for another. So how do you know if you're actually constipated? The medical definition of chronic constipation usually includes 2 or more of the following symptoms for at least 3 months. Straining during bowel movements, hard or lumpy stools, a feeling that you didn't completely finish, fewer than 3 bowel movements per week, needing manual help, such as using your fingers or applying pressure to the abdomen. If any of these sound familiar, you're not alone. Constipation affects up to 30% of people over 60, and that number climbs with age. Now, what's considered normal? Well, for healthy older adults, A bowel movement every 1 to 2 days is ideal, but even going every 3 days can be fine, as long as it's comfortable, soft, and doesn't involve straining. What matters most is how you feel during and after. Are you dreading bathroom visits? Do you feel bloated, heavy, or like you're carrying around yesterday's meal? Those are signs your gut needs support. Many viewers have shared their own experiences, like the 70-year-old who wrote, "Once I hit 60, garden variety constipation just showed up. Now I use 3-4 dose of Miralax daily and all is well." That's a perfect example of someone tuning into their body and making adjustments that work. So don't let numbers alone define your experience. If your bathroom habits have changed, or if something just feels off, it's worth paying attention. Constipation isn't about shame. It's about listening to your body and taking action early. When it comes to constipation in older adults, it's rarely just one cause. More often, it's a combination of factors, some obvious, others hidden in plain sight. Let's start with medications, one of the biggest culprits. Many commonly prescribed drugs slow down the gut. These include anticholinergics, used for allergies, sleep, and bladder control. Opioid pain medications, like codeine, morphine, and oxycodone. Calcium channel blockers, often prescribed for high blood pressure. Iron and calcium supplements. Diuretics, which can cause dehydration. One large review in 2022 identified these as the top drug-related contributors to constipation in older adults. Unfortunately, many people don't realize their medication may be the root of their discomfort. Next, there's dehydration. As we age, our sense of thirst dulls. Some people intentionally drink less to avoid nighttime bathroom trips or incontinence. But without enough water, the colon draws more fluid from the stool, making it dry, hard, and painful to pass. Then there's lack of dietary fiber. Many seniors eat less, and what they do eat is often low in fiber. Plus, dental issues can make crunchy fruits and vegetables difficult to chew. One commenter pointed this out directly, asking why dental problems weren't discussed more often. It's a great point. Let's not forget lack of physical activity. Movement helps the bowels move. Even a gentle walk after meals can make a big difference. A 2020 study showed that walking just 30 minutes daily improved bowel frequency and stool consistency in older adults. Finally, underlying medical conditions can also be at play. Parkinson's disease, diabetes, hypothyroidism, multiple sclerosis. These all affect nerves and muscles that control digestion. One Vietnam veteran shared how Agent Orange damaged his thyroid, contributing to years of bowel issues. Another viewer with MS said they often don't realize they're constipated until bloating becomes severe. In short, constipation is complex. It's not just aging. It's aging plus medications, plus hydration, plus diet, plus activity levels, plus health history. That's why treating it isn't about one magic fix. It's about building awareness and making adjustments on multiple fronts. Eat more fiber. It's one of the most common pieces of advice for constipation, and for good reason. Fiber adds bulk to your stool, helps it move through the colon, and nourishes the gut microbiome. But for older adults, the type, amount, and how you add fiber matters a lot. Let's start with the types of fiber. There are two main categories. Insoluble fiber, found in whole wheat, raw vegetables, bran. This adds bulk but can be hard on sensitive stomachs. Soluble fiber, found in oats, psyllium, and fruits like kiwi. This dissolves in water and forms a gel-like substance, helping stool move more smoothly. One study in nutrients showed that soluble fiber, especially psyllium husk, can improve stool consistency and increase the number of weekly bowel movements in older adults. It also feeds beneficial gut bacteria. That's why psyllium, found in Metamucil and generic brands, is often the fiber of choice. But here's the catch. It only works if you drink enough water. Without hydration, fiber can actually make constipation worse. And it's not just psyllium. Bran cereal, prune paste, oat fiber, they're all effective, but they come with caveats. One viewer wrote, "Steel-cut oats changed my life. 1 cup cooked 4 or 5 days a week, and I'm regular again." Another swears by all brand buds, mixing them daily with her cereal and adjusting based on results. Still another said, "Prunes didn't work for me. Kiwi did." All of these are great, but the real key is this: introduce fiber slowly. Jumping from 10 grams a day to 30 overnight can cause gas, bloating, and discomfort. Instead, add 5 grams every few days and see how your body responds. Aim for 20-30 grams per day, depending on tolerance. Another tip, try getting fiber from real food before supplements. Prunes, kiwi, steel-cut oats, and beans are gentle and naturally hydrating. They also contain sugars like sorbitol, which pull water into the colon and soften the stool. And yes, there's real science behind prunes. They're rich in fiber and have a mild laxative effect. But some people find them too sweet or gassy. In that case, kiwi may be a better alternative. One viewer said, "Prunes make people feel old. Kiwi feels fresh, and it works." In fact, several studies now support kiwi as an effective, gentler alternative to traditional fiber supplements. So if you've tried fiber before and it made things worse, don't give up. Try a different type. Go slower. Drink more water. Track what you eat and how your body responds. You might be just one tweak away from getting your system moving again. This is where things get confusing for a lot of people. Which laxatives can you use every day, and which ones should only be used when things are really stuck? Let's break it down. Think of laxatives in 2 categories. 1. Maintenance treatments. These are the gentle daily options meant to keep things moving. They're safe to use long-term and help prevent constipation from building up. The most commonly used maintenance options include osmotic laxatives like polyethylene glycol, PEG, brand name Miralax. These draw water into the colon, making stools softer and easier to pass. Supported by research, a 2020 review called PEG, the most effective and well-tolerated laxative in older adults. Low-dose stimulant laxatives like Senna or bisacodyl. These help stimulate the colon muscles to contract. Yes, they can be used daily in many cases, despite the old myth that they make your colon lazy. That myth debunked. A 2018 study found no evidence that stimulant laxatives cause dependence or long-term damage to colon function. Prunes, psyllium, or bran, if well tolerated, not technically drugs, but they can be part of your daily regimen. A typical maintenance plan might be 1 capful of Miralax in the morning, 1 and 2 Senna tablets at bedtime. Then adjust based on results. Too loose? Cut back. Still straining? Bump up slightly. Now here's where many people go wrong. They think every laxative is a maintenance laxative. Not true. 2. Rescue treatments. These are for emergencies. When it's been 3 to 4+ days and things feel stuck, you're bloated, uncomfortable, and nothing's moving. Rescue options include glycerin suppositories, inserted rectally. They help stimulate a bowel movement within 15-60 minutes. One viewer asked, "Why aren't these maintenance?" Good question. While they're safe, a 2019 study warned they shouldn't be used as a daily routine. They don't treat the root issue, and over-reliance can mask deeper problems. Enemas, saline or tap water enemas, can clear a blockage quickly, but should only be used occasionally. Frequent use can lead to electrolyte imbalance, especially in frail older adults. Magnesium citrate, an oral rescue used to flush the system. Very effective, but can cause cramps and should not be used regularly in people with kidney problems. The idea is this: You shouldn't be using rescue options more than once every few weeks. If you're needing them often, it's time to rethink your maintenance plan or talk to your provider. Why this distinction matters. Using the wrong type of laxative daily can make symptoms worse or hide red flags, and not using the right rescue at the right time can lead to fecal impaction, a hardened stool that blocks the rectum and may require emergency care. Think of rescue as resetting the system. Once things are cleared, you go back to your maintenance routine and work to prevent another backup. One viewer put it perfectly. Once I understood the difference between maintenance and rescue, I stopped chasing symptoms and started managing my body better. That's exactly the goal. If you've been struggling with constipation for weeks, months, or even years, you're not alone. But here's the good news. With a thoughtful plan, many older adults can get back to regular, comfortable bowel movements. Let's walk through what that plan looks like. Step 1. Track what's really going on. Before reaching for another supplement or laxative, start by keeping a daily log for a week or two. What you eat and drink. When you go to the bathroom. What it felt like. Easy, strained, incomplete. Any medications or supplements you're taking. This helps you and your doctor spot patterns and avoid guessing games. Step 2. Look at medications. As we covered earlier, medications are a major factor. Ask your doctor, are any of my prescriptions causing or worsening constipation? Are there alternatives? In one viewer's case, just switching from iron sulfate to a gentler iron formulation reduced her symptoms significantly. Others found that lowering their calcium supplement or adjusting their blood pressure meds made a big difference. Step 3. Get consistent with your routine. Your gut loves regularity. Here's what helps. Go to the toilet at the same time each day. Ideally 20-30 minutes after breakfast or lunch. Don't rush. Elevate your feet on a toilet stool, like a squatty potty, to mimic a more natural squatting posture. These small tweaks can help retrain your body to expect and achieve a bowel movement at the right time. Step 4. Prioritize fiber and fluids. By now you know fiber is key, but so is water. Aim for 6 to 8 cups per day, more if you're adding fiber. Start with food-based fiber, oats, prunes, kiwi, lentils, and slowly introduce psyllium or other supplements if needed. Remember, go slow, track results, and adjust. One recent study found that increasing fiber from real foods allowed 59% of older adults to stop using laxatives altogether. That's a big deal. Step 5. Build a personal maintenance plan. Here's where you fine-tune. If food and hydration alone aren't enough, consider adding PEG, Miralax. A 20/20 review supports it as both effective and safe for long-term use in older adults. If needed, layer in Senna at night or psyllium with breakfast. Keep using your daily log to see what works best. Adjust as needed. Health changes, diet changes, and even travel can affect your rhythm. But once you know your body's pattern, you'll be able to respond with confidence, not panic. Step 6. Be ready with a rescue plan. Don't wait until you're in agony. If it's been more than 3 to 4 days and things feel stuck, use a glycerin suppository, a saline enema, or, if advised by your doctor, a dose of magnesium citrate. Clear things out gently and then return to your maintenance routine. And remember, if you're relying on rescue treatments more than once every few weeks, that's a sign your daily plan needs adjusting. Constipation isn't one size fits all. Your plan should reflect your body, your routine, and your comfort. What works for one person may not for another, and that's okay. The most important thing, don't give up. You're not broken. You're not alone. And with the right steps, you can take control of this part of your health without fear, shame, or surprise. Most cases of constipation can be managed at home with simple changes, but sometimes your body is trying to tell you something more serious is going on. That's why it's important to know when to stop experimenting and start asking questions. Here are 6 red flags that mean it's time to talk to your doctor. Blood in the stool. Bright red or black stool can indicate bleeding somewhere in the digestive tract. Unexplained weight loss. Losing more than 10 pounds without trying could signal something beyond constipation. New or worsening symptoms, especially if you've always been regular and suddenly aren't. Severe abdominal pain or bloating. This could mean an impaction or even a partial blockage. Rectal pain, especially if it's persistent or comes with other symptoms. Family history of colorectal cancer or inflammatory bowel disease. If that's in your background, don't wait to mention it. In those situations, your provider might order blood work to check for anemia or thyroid problems, stool tests to look for microscopic blood or signs of infection, imaging, an X-ray or CT scan to check for blockages or impaction, colonoscopy, especially if you're overdue for screening or showing concerning signs. One viewer shared that after prostate surgery, he began having persistent bowel issues. This video helped him recognize what was normal, what wasn't, and how to prepare for a conversation with his doctor. That's the key: preparation. Bring a symptom log, note which medications you're on, share what you've already tried. The more informed you are, the more precise and helpful your provider can be. And if your doctor dismisses your concerns, get a second opinion. Constipation is not trivial. It deserves to be taken seriously because your comfort, safety, and independence depend on it. Let's take a moment to bring everything together. Constipation isn't just a bathroom issue, it's a full body issue. It affects how you eat, how you move, how you sleep, how you think, and even how you feel about yourself. For older adults, it can also mean the difference between independence and needing help. But here's the most important thing to remember. You are not stuck with it. By understanding your body, adjusting your habits, choosing the right tools, whether that's fiber, fluids, or the right kind of laxative, you can regain control. You can prevent emergencies. You can avoid the pain, the stress, and the unpredictability that chronic constipation brings. So here's your next step. Start tracking, review your medications, try small, consistent changes to your diet and routine, build a maintenance plan, be ready with a rescue option, but don't rely on it. And most of all, talk to your provider. Don't wait. If you found this video helpful, please consider subscribing to the channel. We'll be diving deeper into related topics in upcoming videos, like prescription medications, bowel health and dementia, and how to safely taper off laxatives if you're ready. And if you've got questions or something that worked for you, share it in the comments. Your tip might help someone else. Constipation may be common, but suffering through it doesn't have to be. Take care, and I'll see you in the next episode.